Yeah, 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 yeah. When the going is smooth and good, many people will be your friend. But when the going becomes tough, many people will run away. Hi, man, I remember in those days, in the 90s, when William Oyabo brought out this music. It used to be the order of the day. Well, my dear people, I welcome you guys to this session. I want to use this opportunity to talk about an important issue that has been bothering me, right? Now, someone just asked me, Doctor, is it true that if I have uterine fibroid, that I shouldn't take folic acid when I'm pregnant? Or even if I'm trying to get pregnant, should I not take folic acid? Remember that I made a video about folic acid, the benefit of folic acid in pregnancy, and how it prevents individuals from having neural tube defects. Now, this challenging question is coming from one of us. He said, if I have fibroid, can I take folic acid? Is it going to worsen the growth of uterine fibroid? Does it cause uterine fibroid? Well, I have to answer her straight. So far, no evidence has shown that uterine fibroid, intake of folic acid causes uterine fibroid. And then we have not seen enough randomized control trial or systematic review that has shown that intake of folic acid worsens the growth, accelerates the growth of uterine fibroid. However, note that for women who have malignancy, who have cancers, we usually tell them not to take folic acid. The reason is very simple. Folic acid is often utilized by tumor or tumor cells, to increase the growth, their growth rates, or accelerate the growth of cancer cells. So because of that, oftentimes individuals may extrapolate that if this happens in cancer, that it can also happen in benign conditions, and that's why people will always tell you avoid folic acid and all that. However, I know that some authorities have also made reference to fibroid coexisting with pregnancy, that it depends on the size of the fibroid. That if the fibroid, you already have a large fibroid mass, that you should reduce folic acid intake because it may accelerate the growth and then have an impact on the growth of the fetus as well. So that's at an individual practitioner's level, right? So it has not been subjected to any systematic review, or it has not been subjected to randomized control trials in order to prove that when you give a woman folic acid, that is going to accelerate the growth of uterine fibroid, right? So until then, available evidence has not proven that folic acid worsens, or rather folic acid causes uterine fibroid. Okay, but that doesn't mean that caution should not be exercised. If you are pregnant and you have a huge fibroid, it's likely that this folic acid may can accelerate the growth, and then it can, because of the rapid growth, it can affect the fetus in utero. I hope I've been able to answer your question. Now back to William Oyabo in 1990. I'm going to put back the music for you to enjoy. Catch you in the next one. Cheers.